another type of dementia is vascular dementia. And so what will happen in vascular dementia is people will have little, typically what we'll see is people will have small, tiny strokes in the front parts of their brain. And these little strokes, people might not even know that they're having them. It's not your classic stroke where, you know, half of your body goes numb and you lose motor functioning, where you clearly know you're having a stroke. A lot of times in vascular dementia, people, the strokes are so small they don't even know they're happening. But they happen after a while. They accumulate, and these vascular lesions impair cognition. And so most commonly what we see is that we see an accumulation of small, tiny strokes in the front parts of the brain, and people start to lose their cognitive abilities. Of course, we also see dementia from the large classic strokes as well. And so these large classic strokes where people do lose, you know, motor control on half the side of their body, and they do lose sensory functioning on half the side of their body. Of course, those can lead to dementia as well. More commonly, it's these small ones that we'll see. And so with vascular dementia, the risk factors, as you might imagine, are all the risk factors for vascular disease. So it's things like smoking, high blood pressure, high cholesterol, not exercising. It's all of the classic, anything that can give you vascular disease in your heart can also give you vascular disease in your brain. And so when we talk about how to protect your brain, what can you do to protect your brain? My goodness, it's not smoking, it's exercising, it's getting your hypertension and your high cholesterol under control. And so with vascular dementia, their memory impairments are a little bit different. What we'll see with vascular dementia is while they do have memory impairments, they have promptable memory impairments. And so for vascular dementia, I might give a person 3 words to remember: apricot, table, and penny, and then we'll distract them, and then I might go back to them, and they might not remember any of the 3 words. But then in my vascular dementia patients, I'll say, okay, one of them was a fruit. And they'll say, oh, doc, that was the apricot. And they just remember. Okay, well, one of them was a coin. I think it was a penny. Okay? And so while they have memory impairments, they have promptable memory impairments. And so that's kind of one of the ways we start to differentiate between vascular dementia and Alzheimer's disease, is based on, do they have promptable memory loss or do they have non-promptable memory loss? The other thing that we'll see with vascular dementia is this classic stair-step down pattern. And so with Alzheimer's disease, if you look at, so if this is time and this is cognition or memory, in Alzheimer's disease, what we'll see is just a steady decline downwards. Okay? That would be Alzheimer's disease. In vascular dementia, what we'll see is someone will be at a current level, and then they'll have a stroke, and they drop down. And then they're at that level for a while, and they're doing okay, and then they have another stroke, and they step down. And so it's more of a stair-step pattern down. It's not this continuous gradual decline. It's this they just kind of stair-step down, and every time they have another stroke, they take a cognitive loss, and then they're at that level for a given amount of time, and they might have another stroke, and then it's another loss. And so they stair-step down, as opposed to Alzheimer's disease, which is generally this unrelenting slope downwards. And so what's nice in a way about vascular dementia is that if you can control for the vascular risk factors, vascular disease risk factors, you're not necessarily declining. And so it's quite possible that a person might have a stroke, and then they get their hypertension and their high cholesterol under control, and they stop smoking, and then they may not step down ever again. They could just keep going along at that certain level. And so it's not this unrelenting decline downward.
Mmlearn.org